Videos on the subject of pressure sores or decubitus ulcers, but I usually call them pressure sores. Now, a pressure sore is the degeneration of tissue as a result of pressure. Now, normally, well, even now I'm moving around a bit, or when we're sitting we move around a bit, and then when we're in bed we move around. In fact, in a normal night's sleep you can turn over 100 times or more than 100 times in one night to change your position. But your patients who are ill or immobile for whatever reason are not able to change their position. So the weight of their body as it's transmitted to the ground or the bed or whatever they're sleeping on is always on the same place. And that pressure always on the same place can cause pressure sores. So pressure sores occur over parts of the body where the pressure is transmitted down into whatever the person is sitting or lying on. And these areas are called pressure points. So pressure sores can occur in immobile patients over pressure points. It's a very important part of nursing to prevent pressure sores from forming. These things are nearly always preventable. And basically we prevent pressure sores by keeping the patients, continuously moving the patient's position. At least every hour. So you can lie them on one side for an hour, on another side for an hour, on the back for an hour. And keep changing their position. Regular changes of position in a completely immobile patient. Other patients you might just need to move them every 2 hours. But the key thing is keep relieving the pressure. Keep changing the patient's position. So if the patients are unable to change their own position, you must change their position for them. Now what we're going to do is look at pressure, look at pressure sores, and look at pressure sore prevention in some detail. And this is something all nurses certainly need to know about. Now the first thing I'm going to do is introduce what we mean by pressure, the concept of pressure itself. So the concept of pressure. Well, pressure is determined by two factors. The amount of force pressing down and the amount of area it's pressing down on. So for example, if you had two blocks that weighed the same and one was this shape but one was this shape, they both weigh the same, and because they both weigh the same, then the amount of downward force generated by their weight under gravity would be the same. But this block, the force is transmitted over that much area, and this block is transmitted over a much smaller area. So I think you can see the pressure per unit area here is much greater than here. So two factors involved, force and area. So pressure is force actually divided by area, force over area. Force per unit area. And when we come to apply this clinically, this is a fairly important clause here. The amount of pressure required to close skin capillaries is 25 millimetres of mercury. 25 millimetres of mercury, which isn't that much pressure. So let's look at a few examples of this now to try and bring it to life a bit. So a simple demonstration of pressure just with a knife and some margarine here. When I rest the knife on it with the flat of the knife, I've got the weight of the knife acting over that flat part of the knife, the area. So the area is fairly wide and the knife doesn't sink in, it just sits on the margarine there. But if I turn the knife over so it's the narrow point, the sharp point of the knife, then just the weight of the knife is enough to let the knife sink into the margarine. So the weight is the same in both cases, but because there's a wider area it doesn't sink in, but then when there's a narrower area then it does sink in. So pressure is force over area. So we have a clinical example of a pressure point. Imagine these blue towels here are tissues, and this is the bone inside the tissues. And I think you can see that the weight of the bone here compressing these tissues, because there's a fairly small area for the weight of the bone to work through. So you get pressure between the bone, in this case, and the hard surface that the patient is resting on, compressing these tissues. And if these tissues are compressed for long enough, it will occlude the circulation and these tissues will die forming an ulcer or a pressure sore. Now it's quite easy to demonstrate what 25 millimetres of mercury feels like. You can simply do that using a Svig cuff, and I can just pump this up to 25 millimetres of mercury, and you find that it's not that much pressure. It doesn't feel that tight on your arm. But if you leave a pressure of 25 millimetres of mercury pressing on the tissues, that is enough to close the capillaries in that tissue, therefore deprive that tissue of its blood supply, therefore it will start to die and it will ulcerate. A pressure sore will form. Let's now define what we mean by a pressure sore, the definition. And of course, you read many definitions, but let's have a few ideas to try and develop what we're talking about. One definition here: any degenerative changes caused under the influence of compression and or shearing forces acting on tissue. So whenever a tissue is compressed, or whenever there's shearing forces acting on a tissue. So what we haven't looked at yet is what we mean by shearing forces. So let's look now at an example of compression and shearing forces. So here we're looking at my fingers, but behind a piece of glass. What I'm going to demonstrate first of all is the effect of pressure. So you can see now that I'm just applying a very slight pressure actually on my fingertips. And you can see there that they've gone white. Well, the reason they've gone white is that the pressure is enough to stop the blood going through the capillaries. Because there's no longer any red blood in the capillaries, the tissue appears white. And if I maintain this position for long enough, pressure sores would develop on my fingertips. But if I relieve the pressure, you can see they've gone pink again. They've become reperfused. So it's the same with your patients that are in bed or is sitting in chairs for long periods of time. When they're sitting, the blood supply will be reduced or cut off to the area. But when you come along and change the position to relieve the pressure, then the area will reperfuse with blood and the patient, the tissues will remain viable. So pressure on, you come along, change the patient's position, the pressure is taken off, the area is reperfused, and the cells in that tissue are nourished again. So that's an example of pressure and pressure relief. Now the other group of forces we mentioned were shearing forces. Now shearing forces is the tendency for the patient to slide down the bed, and I can duplicate this as well. Imagine this is the patient's back, that's my hand here, or any part of the patient really, and the glass screen this time is the bed or the surface they're on. Now as the patient tends to slide down the bed, I think you can see there that the tissues are distorted, and again here, because the skin tends to stick to the surface, and of course the rest of the tissue with the bones inside moves along and you get shearing of tissues. And this shearing of tissues also closes the blood supply and damages the tissues, allowing a pressure sore to form. So the patient suffering from shearing forces. So here we see this pressure effect in diagrammatic form. The pressure here, actually this probably the whole thing will be upside down actually, the pressure coming from beneath, but never mind, there's pressure here on the skin surface. Underneath the skin surface there's a bone. And between the bone and the pressure being exerted, the tissue is compressed. So this area of tissue is compressed. That has the effect of squeezing shut the blood vessel. So the blood supply to this area will be reduced, if not cut off altogether, and that will lead to degeneration of this tissue. And pressure sore formation as this tissue starts to die because it's been deprived of its blood supply, because it's under pressure. Now pressure sores don't appear all of a sudden, they take time to develop. And usually pressure sores first appear as red areas located over pressure points, which as we've seen are often bony prominences. where the tissues are compressed between the outside